Good morning, good afternoon, and good evening, all. Welcome to our second day. I beg that we give it about 2-3 more minutes to get more colleagues joining, and then we'll start. Good morning once again. Welcome to our day 2 of our daily debriefs. Again, this is courtesy of the Advocates Corner, sponsored by Casper, the project, and led by HIVR. Welcome. I see we're here in big numbers. Thank you for joining for day 2. And I want us to dive right into our day. Again, just to thank our team at HIVR4P that have been able to represent us in person there. Today on our speakers, we do have what you see on your screens, by the way, is some of the collections we've been able to get from HIVR4P, some of the lovely pictures. They're not top quality, but that is somewhat a roundup of what has been happening at HIVR4P. Some faces are familiar, others are new faces, but you'll see in the slides those are some of the sessions that have happened in the last 2 days, and we will keep the updates coming. On my agenda today, without any other time wasting, I would want to call on Grace Kumwenda. She's a regional manager with HIVR, and Grace has been quite instrumental in talking about the People's Research Agenda, and it's what she's going to really talk about today on our call, just to give us an overview. And she had a very lovely session in the Advocates Corner. I think her sessions are one of the sessions that opened up the Advocates Corner, and you'll see in one of the pictures, she's in there really talking about the People's Research Agenda. Grace, I want to call you to just give us an overview of what the PRA is and, how it has been received at HIVR4P, but also your experience at the conference in the 3 days that you've been there.
Thank you so much, Bridget, and thank you for the invitation. Good morning, good afternoon. The conference, the HIVR4P conference, have really been exciting in terms of the sessions that we're seeing, some of the updates we're getting across the HIV prevention research pipeline. I want to talk about the People's Research Agenda, which we launched on Sunday, and we were lucky or blessed to have the head of NIAID, Jean Marazzo, actually launch the document. But what we're thinking around when we look at the People's Research Agenda, because when you look at advocates, oftentimes it's, oh, it's another report, oh, it's another document. When we look at the People's Research Agenda, for us, it's not just a document, it's not just a report. This is a tool that is supposed to be used by communities. It's a tool that is supposed to be used by funders and researchers. It really focuses on what, if you look forward in the future, what are the priorities for HIV prevention research and development. So briefly, to just give you an idea of what this is, so the People's Research Agenda is part of an initiative called Coalition to Accelerate and Support Prevention Research, which is CASPR. Most of you are part of this coalition, but if you didn't know about that, now you have an idea of what that is. CASPR is supported by USAID, and it brings together a lot of partners within Sub-Saharan Africa, Eastern and Southern Africa. The People's Research Agenda, basically, as I said, it outlines community-defined priorities and recommendations for HIV prevention research for the future. And what we did was to come up with an approach that would allow as much consultation, as much engagement with communities and advocates into the process. This is the People's Research Agenda. So it's not about AVAC, it's not about CASPR, it's about what our community is saying about the future of HIV prevention research. And so in terms of the consultation process, we did have several methodologies. We used surveys, we used convenings, community convenings, we used think tank meetings, and all of these in total brought about over 130 advocates who engaged in the process. And I want to believe that every advocate who engaged in this process basically is the voice behind the People's Research Agenda. And we hope that even everyone on this call becomes the voice for the People's Research Agenda. The representation from the people that engaged came from over 23 countries. So looking at Asia, looking at South America, the USA, Africa. So it is a global agenda. It is looking at where we need to be going as a globe towards HIV prevention. And we wrestled with two big conversations. So conversation around what needs to be prioritized in terms of products in HIV prevention research, and also how should community engagement, how should processes of research be done as we move forward. The document provides very comprehensive feedback, concise. We held so much, but we had to abridge things into a 13, 14-page document. But as I said, this is a living document. We are actually hoping and anticipating that we will be getting feedback from communities, from researchers, basically all stakeholders, and we'll continue adding on to the current version of the People's Research Agenda. Right now, it is on the AVAC website. You would be able to access it and download it and take a peek at it. But most importantly as well, the website will have a link to the feedback form where you should be able to give any feedback around what you've read or what you're hearing, or if you feel that something is missing and it's critical for us to be talking about in the People's Research Agenda, we welcome that feedback. But just quickly to mention, to say, in terms of the report itself, the People's Research Agenda itself, it has three core insights. First core insights are around community engagement processes. And under that, we are talking about making sure that funders and researchers are making an effort to deliberate with communities. And when we talk about deliberating in this sense, it's not just about once-off engagement. Deliberation is a partnership approach. So we are making and a demand from researchers, from funders, that we need to come to a point where we are deliberating about the preferences of people, of options that people need. We're also making a call around what we call delineate. So for this one, we are saying there are products in the pipeline, but we know that the HIV prevention research and development, there's so many other tools that are coming in. Can we sit back and look at what is missing within the toolbox that we have in terms of method of delivery, in terms of frequency of dosing? Is there anything else that needs to be added? And we're also making a call for democratization of processes, where power is shared, where communities are not seen as the last on the list. You will notice that oftentimes when you're doing presentation in scientific conferences, community perspectives are always the last. But what we're saying is communities are at the center. We've said this a million times, but can we start seeing that being a lived reality as well? The other core insight around this is how clinical trial designs are going to be conducted for the future. So we do have a clinical trial design academy that has kind of inputted into that process, because we know with having HIV prevention methods that work, such as long-acting injectables, you start asking that, how are we going to then conduct trials, and what are we going to compare the new products with? And how will research look like? So we are making recommendations around that as well. And finally, an exciting bit of it is there are aspects and recommendations specifically for products. So recommendations around oral PrEP, around the pivirine vaginal ring, around long-acting. So specific recommendations for all the product categories. I think in the interest of time, let me leave it there, because I know other people might want to also come in and ask questions, so that this is a conversation and I'm not the only person talking. But we are really looking to be getting feedback from you. And also we will be coming to you in terms of next steps of how we move forward the people's research agenda at regional level, at country level. Because as I said, this is not just a document. This is a movement. This is an agenda that all of us need to rally around. Thank you so much, Bridget.
Thank you so much, Grace. And I've had the honor to, just take a look at the research, the People's Research Agenda. And I think it's a well thought through document. And again, as you mentioned, this is not about AVAC, it's about your communities. I mean, the advocates, the people that research is impacted. Grace, I think before you, just mute, I just wanted to know, away from the People's Research Agenda, and colleagues, I welcome questions. Grace will be able to take those questions. Is there anything else that caught your eye at the conference away from the People's Research Agenda? Because I know you've also, been in a couple of sessions at HIVR4P.
Thank you so much, Bridget. So one of the sessions that caught my attention was a session that we had in the morning. It was on novel antiretroviral formulations for prevention. For that session, we kind of held a little bit of what's new in the HIV prevention space in terms of the R&D. Some of the data that was shared in that session was data from previous trials that kind of were stopped. Some of you might be familiar with the study Empower 22, which was looking at or investigating an oral monthly PrEP product, Islavta. But this product or this study was stopped early because of adverse events that were reported. So they were basically reporting some additional data. And I think what was exciting for me to hear from that, even though the study was stopped, was to hear that after they stopped it, they continued on as an open label. So they continued to follow up every participant for another 18 months. And it was exciting to hear that there was no HIV acquisition in that period in the study arm. So for me, what that said is, it would be exciting to actually have an oral monthly PrEP product. For some of you that are also aware, the same pharmaceutical company is now investigating, and they talked about it a little bit, an oral monthly pill, a different kind of a product, but kind of building on the lessons from Islavita. So for this product, it's now in phase 2. They talked briefly about it, but it's in phase 2. It is anticipated that this product is going to be going into efficacy trials quite soon. And advocates have been engaging on how the trial design should look like, and maybe just making a call to say that's something that we all need to look out for. So there was a lot of conversation around these novel products. What are the new products that could come out of the pipeline from that session? And for me, that was one of my most exciting sessions for yesterday.
Thank you so much, Grace. And we love new products. I mean, we are all up for new products. But also to quote what Yvette said yesterday, I think we also need to do a lot of work into making available the products that we already have, pushing them to the people that need them. If you have, a question to Grace, you want a comment, even if it's not a question, please go ahead and raise your hand. But also the chat is your friend. You can go ahead and use it. At this moment, I want to call Stacy. Yes, I see you. You're on my screen. I want to call Stacy. Stacy is also with AVAC, and Stacy is basically just going to again tell us, as I keep telling you, I think this is a space for us to just share what's happening at HIVR4P, and just to share experiences and those sessions that really speak out to our speakers. But as I realize, there are quite a number of us on this call that are in the conference currently. So you're also welcome to just get off mute and share, some of the takeaways that you're picking from the conference. But at this moment, I would love to call Stacy to come in and share a little bit about her experience there. And I know, Stacy, you've taken part in some sessions around LEN and around ISL presentations. So I really just want to call you to share all of that with us. You're welcome.
Sure, thanks. Thanks, Bridget. Can you hear me okay?
Yes, we can.
Oh, great. Okay. And I'm so relieved. I always love when people are on video, but I was like, it's 7 a.m. I'm not going to go on video, but it's really great to see. It's really great to see such a good group of people. And so also just want to reiterate the big thank you to you, Bridget, for putting these calls together. I know it's hard to do from a distance. And there's clearly lots of interest. I'm gonna try to keep it brief and just give kind of the high points, and then kind of kick it over. Lots of people on the line who are at the conference as well. And I'm sure lots of people who might have questions. But maybe just to quickly build off of Grace's sort of overview of the two sessions on the islatravir trials. There were two presentations, one on Empower 022 and one on Empower 024. So the cisgender women's trial, and then the MSM and trans individual trial. And I think what Grace said, I think most of us on the line kind of know the story of islatravir. And so I think that these data from these two efficacy trials were kind of, long awaited. I think people were really kind of anticipating knowing sort of that readout of the follow-up of the participants in those trials, people who had been on islatravir and then had to stop it because of this this effect that was seen on the CD4T lymphocytes. And I think as people, I'm not going to go into the whole history of it, but I think as people remember, that's why the islatravir for prevention program was halted. And there's been this sort of several year gap with Merck in their endeavor to develop a monthly oral pill for prevention. And so what was in addition to what Grace said about the monitoring for any seroconversions. What they also presented was the more long-term data about the impact on the lymphocytes. And what they did show is that when they followed up, I think the follow-up period, and we don't have any of this documented, so I think we just have some blurry sort of photos and screenshots here and there of the slides that were presented, but surely we will have access to the slides soon. I can't remember when HIVR4P allows kind of open access to the presentations and the slides from the conference, but what they did show for both for both efficacy trials is that within that 18-month period, the individuals who were on islatravir and had this sort of dip in lymphocytes, the lymphocytes did return back to normal. And I know in the cisgender men's trial, it was at 10 months, it was about the 10-month mark after they had stopped islatravir that the lymphocytes returned to normal. And I want to say, do not quote me on this, for the women's trial, it was 9 months, but they showed these sort of big graphs that were a little hard to follow. But essentially for in both trials, the lymphocytes did ultimately return to normal. And I think that was the big question for the Merck team and for the field was this did this kind of impact on lymphocytes from islatravir kind of reverse? And then I think probably what's on a lot of people's minds is sort of how does that translate into Merck's new development program of the monthly pill? As Grace mentioned, they don't have a fun name for it yet. It's they just have the kind of molecule number or whatever. It's MK-8527. And I think as people know, the phase 2 is ongoing right now. They're really working towards launching the efficacy program of MK-8527 next year, I think as ASAP in 2025. What we do know is that in the phase 2, they're monitoring for this impact on the lymphocytes. And I think the big kind of question for developing MK-8527 is what is the kind of sweet spot in terms of the dose, the monthly dose? Because I think what they concluded from islatravir is that it was a 60 milligram dose once a month, and that was just too much, and that was why they were seeing this impact on the lymphocytes. So what was said is that we do know the dose of MK-8527 is going to be kind of like factors lower than that. So it's kind of a balance of like how much can you, because you want to have her, for a monthly, for an intervention that you're going to take monthly, you obviously want to have a level of forgiveness, right? If you think about any of us who take something once a month, or, those of us who get a period, it doesn't always happen, exactly 30 days or exactly, on the first of the month. So, so you want to have some forgiveness there. But again, the lesson from islatravir was that, they had sort of overcompensated on forgiveness, and the dose was just too big. So we shall see. And I think there will be more information coming out about MK-8527 soon. And I think something as advocates really important for us to watch, including, as Grace mentioned, the trial design of that efficacy program. So that's a little bit more on islatravir. And Merck's monthly pill program. And then I will just touch briefly on the lenacapavir in that same session. As Grace mentioned, there were also two presentations about Purpose 2, and I'm sure we all have followed Purpose 2 pretty closely. I can't remember exactly when those as we all know, Purpose 2 was very recently halted early for a strong efficacy result. I think people, and we saw the press release come out, so just as a reminder, the Purpose 2 trial was looking at lenacapavir versus oral Truvada. And in the lenacapavir arm, there were only 2 incident infections. In the Truvada arm, there were 9 incident infections. The primary endpoint was comparing lenacapavir against a background HIV rate. And that comparison showed a 96% relative risk reduction for the people who were on lenacapavir. When the lenacapavir arm was compared to the Truvada arm, that was an 89% risk reduction. So, and for both of those results, it's a superiority result. So, so we do, we can kind of read out that lenacapavir is superior to daily oral Truvada from Purpose 2. I think, as everyone remembers, in the Purpose 1 trial, there were 0 infections. So, but still, this is still a really great result. And again, as everyone knows, Gilead is moving forward really rapidly with the regulatory submissions, with generic licensing, so the one thing about the data is that I think a lot of people, because there's a big question about, there's questions about resistance and sort of PK, like how long does this sort of tail last with lenacapavir, and kind of adherence data, both, especially sort of adherence in the oral Truvada arm, as well as more information about those 2 incident cases, right? Like, what were those cases that were actually before people started lenacapavir? Was it after? Did people miss a dose? All of those things that I think will really kind of factor in how that kind of gets analyzed and sort of taken into account. And I think people were really expecting them to present that yesterday, and they did not. So we wait. We wait for more information from Gilead. And but then I guess the other thing that I wanted to point out is that the other presentation was about basically about sort of the diversity and the demographics of the Purpose 2 trial population. And I did take a screenshot of this. Let me pull it up. But essentially, there was a very strong kind of, Latin and South America population in Purpose 2 of, hold on, pulling this up. Because I want to make sure I'm right. So 35.6% of the participants were from Brazil, and 13.7% of the participants were from Peru, 6.9% from Argentina. So, a pretty significant portion of the trial population from, Central South America. And as we all know, a lot of those countries have not been included in the generic licensing agreements that just came out, whatever that was, last week. So that's a big buzz, right? And I think something that everyone's going to really have to continue to rally around, and I think hold Gilead accountable to, I think being as transparent as they can, when they can, about how this sort of global kind of pricing of lenacapavir is going to work. And I know that was something that I don't think Jim's on the line, and Jim moderated this session, but I don't think he's on the line. And I know it's something he sort of foregrounded yesterday on this call. The other thing I just wanted to mention, in the Advocates Corner, we had a great session with Carl Diefenbach, the head of DAIDS. And I think just for everyone on this line to know, people are probably already involved, but DAIDS is starting their kind of review for their recompetition process, or in the recompetition will happen. Well, the recompetition process has kind of started. The new funding cycle starts in 2027 of the DAIDS networks. And so, go check it out. They've got, DAIDS has basically all the information online, and they have kind of an open call for input. And I think, DAIDS has kind of said they really want to hear community and advocacy perspective. So I would really encourage people, if you haven't engaged in that process, please do. And, if you need any support in it, I think a lot of us from AVAC and a lot of people on the line would be happy to work together on it. And maybe I'll just stop there.
Thank you, Stacy. That was something. I think to just to follow up on that, to ask, and we're having, and I'm told the conference is really saturated with, you know, conversations around lane, around access, and given the big news that we've received, you know, in the year about Purpose 1 and Purpose 2, I just wanted to know, is there any word or any new data around Discovery itself as being part of the Purpose trials?
Yeah, that's a really good question. And we do know that they had, I mean, when the Purpose 1 initial readout came out, they did have that. I don't have it quite in front of me. That, you know, I think the curious thing, and I don't know if, and I think the purpose, well, yeah. The curious thing is that I want to say, I think the incidence rate in the FTAF arm in Purpose 1 was actually slightly higher than in the Truvada arm. And so, you know, I don't think there was statistical significance in that difference. And we do know that there will be further analysis. I think they're going to do sort of a case control, like a, what do they call it? Not a case control, but essentially they're going to look at, they're going to try to compare, I think, between the Truvada and the Descovy arms, who was adherent. So kind of looking, you know, I think getting more of that adherence data and doing that comparison to see how that levels up. They did in a side meeting yesterday with the Gilead team, they did say that they plan to file for they do plan to file for FTAF in women based on the Purpose 1 result. We also know that there are a couple other like much smaller studies that will kind of add, I think, to the body of data of FTAF efficacy in women, including a program called Project Engage, run by the small biotech company Conrad, as well as the PrEP-VAC trial, which was a complicated trial, but that's a part of it was comparing, also comparing FTAF to, Descovy to Truvada in cisgender women in a number of countries in Africa.
Thank you, Stacy. And anyone can come in regards to that, but it's very good news to hear that, you know, FTAF would be filed for at least for women. That's lovely news. Now, again, feel free to come off mute if you have a comment or an addition to add to what our speakers have shared. But at this juncture, I want to call Ida. You are on the line. Ida is a young woman. She's had a very huge presence at the conference. She's a powerhouse. I want to call you, Ida, to come in and share your experience at the conference and any takeaways that you'd need to share with us.
Thank you so much for that great introduction, Bridget. Wow. Good morning, good afternoon, maybe. For us, it's morning here. And just like Bridget said, my name is Ida. I'm from Zambia. And it's been a packed but really great conference. And for me, one of the greatest actually conferences, because it's so easy to take in and everything is just so experience-based. So I'm just going to talk about some of the few important sessions I have attended myself and since day one, and I'm going to be really quick. So the first one was on implementing choice in HIV prevention. And these were just some experiences from South Africa, just giving a background overview of the prevalence of HIV incidents and also just how choice is looking like in South Africa in terms of HIV prevention and some of the differentiated service delivery models they are using to deliver HIV prevention interventions to adolescents and young people especially, and the use of the mobile gazebos, which are the vehicles that most colorful, famous vehicles they use. I think for me, that was amazing. And they highlighted how in all the interventions, young people are present to be very diverse and very comprehensive, but also holistic and want personal centered approaches in terms of how they can acquire or access and utilize HIV prevention services. There's a lot of excitement around cabotegravir and the depievering ring, not so eager so much, but then still young people, young adolescent girls and young women are accessing the depievering vagina ring and the oral prep. Some are getting condoms, but for them, the catch is that using the mobile gazebos, they can access HIV prevention services when they want, and they can actually go to who they want. And for me, that was a big highlight. But then there was a mention that in all these interventions that are being provided, the key or the catch has been ensuring that the people that are accessing these services actually understand why they are getting them and how they can correctly use these options that they're being given so that they work for them, because it's not just about accessing them, it's also about how it's actually working. And how they are partnering with the Catalyst study just to expand the HIV prevention cascade, but also having asked a question on sustainability in terms of the mobile gazebos, because definitely adolescents and young people like this. They did mention they are having plans of how they can sustain this DST model with the South African civil societies, the community, and even the Ministry of Health on how this could continue. It's a lot, it's a huge cost, but they're planning around how they can do this. But also another important session was the Brightest Under 30 session for the Mosaic project, looking at how far countries and, so this session was basically just to understand how youth engagement in HIV prevention has worked in different countries where the Mosaic project is being implemented, such as Eswatini, Nigeria, Zambia, South Africa, and Kenya. And looking at the adolescents and young people that have been involved from inception and how well trained they are and how much they understand HIV prevention, and how much they have achieved to ensure that there is meaningful youth participation and engagement in HIV prevention through the Mosaic project. For me, that was really great. It was great to see an overview of where they came from. And there was a great testimony from Kenya of how this young person, how she was engaged from very young age up until now, where she's able to stand in such large podium. For me, shows how much work they have done under the Mosaic project and how much they have achieved. And it's really great. And I think most of the Mosaic project youth are well known, not just in their countries, but even globally, which shows how amazing youth engagement. And these are youths that are contributing greatly in HIV prevention interventions and advocacy at not only national, but regional and global level. And I think we can all see the evidence, which puts in how important it is to monitor and evaluate the work that we're doing. But another important session, and this was a CASPA session, which I really, really loved, was catalyzing progress in inclusion of pregnant and lactating people in HIV prevention research. They gave a background of where they've come from in terms of how women have been excluded in HIV prevention research due to fear of adverse side effects, because women are more prone to adverse side effects, hormonal imbalances, and also the fact that some are pregnant and getting the implication to the child, the unborn child or the lactating child. And so these are some of the things that have caused for women not to be included, pregnant and lactating women, and even women or adolescent girls and young women, not to be included in research for HIV prevention. But of course, through civil society engagement, continued advocacy, women are slowly being engaged, and the progress that can be noted. We can see it from the Purpose 1 trial on how engaging women, pregnant and lactating women, is really important because it gives you triple the data. It will give you safety data on the infant, the unborn infant, the mother while pregnant, despite being potential to adverse drug side effects and whatnot. And this has now really showed us that it's really, really important to engage pregnant and lactating people in HIV prevention research, and the progress that has been achieved is amazing. But we're really looking forward to seeing how pregnant and lactating people who have disabilities can also be engaged in the future, because this is still something that we're still not so much strong on, but I feel it can work. And we are likely to see a better inclusion of pregnant and lactating people in HIV prevention research. Another important one was delivering on the process on the DAO prevention pill. And this was an AVAC and UNICEF session, and listening to the advocates talk about how young people want the DPP to be delivered in terms of color, and what are the perspectives of the community, and even the support system of the potential adolescents and young girls that are likely to receive this tool, in terms of would they want to be included? Would they want to be consented? For example, for my country, Zambia, we have the issue of consent. While it's different with other countries like South Africa, they don't have to worry so much about consent, but for us, it's a major issue. And how there's been early engagement of guardians to understand that, to understand sexual and reproductive health of adolescents and young people, and especially adolescent girls and young women. So for me, that was really a huge thing for this session. But also, going to my favorite stuff, broadly neutralizing antibodies and HIV vaccines, I'm going to just wind up. There's been great talks around HIV vaccines and broadly neutralizing antibodies. And when it comes to HIV vaccines, it's how we still need HIV vaccines, because as it been known, vaccines in general have been known to do some of the greatest wonders in terms of disease elimination and eradication globally. And we cannot give up on the HIV vaccine research, despite it being over 35 years, nothing is there. But it was amazing to hear that the complexity of the HIV virus, its mutation, and how complicated it is to just understand it, has helped us garner information on immunology and virology. And it's really important as researchers and advocates to really harness that information, because that information has also helped us to come up with the fastest tools for other diseases such as the COVID-19. And it's from that research that we've garnered that. We are still going to get the HIV virus. The HIV virus is still needed, because it's likely to be the global answer for not only HIV prevention, but also control of the HIV virus for people living with HIV. And for me, that was really, really amazing. The same incentives on broadly neutralizing antibodies for peri and postnatal prophylaxis for infants that have been exposed, and how much broadly neutralizing antibodies could help in terms of controlling and preventing HIV. Just like the term says, broadly, it means they can do so many things, and we cannot give up on the research. And lastly, the last two, the GPP symposium, it was amazing to see how Thailand is really striving to ensure that these good participatory practice in HIV research. And in Thailand, there was a mention that researchers in Thailand in 2024 are still isolated on how they are doing work. They don't want to involve the community. It's all about checking the books, but they believe that with continued advocacy, this is going to work. And lastly, the Gilead's, we had a meeting with Gilead, with Njase Pharma, just to understand what should we expect in terms of lenacapavir. What will prices look like? What about community access? What about affordability? And it was really amazing to interact with Gilead hand to hand between pharmacists, advocates, and even policymakers on what we should look forward to, regulatory processes, approvals. And for me, that was really, really a great time to see that there's that one-on-one facing with Gilead, and how open they are to ensure that people that want lenacapavir for their people are able to access it. And lastly, the Advocates Corner, we had a session with the Young Women HIV Prevention Council, and they recently did a survey on what adolescents and young people want in terms of HIV prevention tools. How should they look like? How should they smell like? And there were so many views on choice overall, because at this conference, choice has been the talk of the day from inception. And it's the huge role the Choice Manifesto has played in that. And the document that the Young Women HIV Prevention Council has come up with on what the HIV, the adolescent girls and young women research agenda should look like is really, really important, because the young women have given researchers, they have given an overview what they want to see. And we will be very closely monitoring to see that researchers are adhering to this document and they're doing what we want. The young women actually want BNABs, even if it's just 2 young women from Southern Africa that want BNABs, they need to be given BNABs. Those that want HIV vaccines, those that want MPTs, DPs, on-demand options, those that want them to be more more attractive, more colorful, more playful, more enjoyable. That's what we want to see in terms of the tools, and we are going to be very closely monitoring and ensuring that researchers are adhering to that. The conference has been so packed. I've attended dozens of sessions. This is just the little that I could sum up. Thank you so much, and I'm open to questions. Thank you, Bridget.
Thank you. I think that was already a lot shared. Ida, thank you for representing young women, but also, you know, just sharing your experience and those sessions at the conference. I think this comes at a time when you mentioned about the young women's HIV prevention research agenda. It's I think it comes at a time when we're also having conversations about the people's research agenda, and just, you know, seeing how even, you know, like these can merge to fit into each other would be really, really lovely. But it's very good that we're having these conversations in one space where we have at least, you know, representatives of, you know, both arms available. Again, colleagues, you're too quiet today. Chat is open. Feel free to raise your hand or get off mute and share a comment or you know, a question you have for any of the speakers. But as we get to the top of the hour, I think before we drop up, yes, Isabella, before I call someone. Isabella, please come off mute and share.
Oh, hi, everybody. First, let me introduce myself. I'm Isabella Fernandez, psychology student, human rights activist, and part of Feminist Peru. It's the largest trans women organization in Peru. We have been together for 9 years, and we focus on community empowerment, advocacy, legal recognition of our identity, and among other things. Medical research and HIV programs in Peru, which for more than 20 years, and we have not seen significantly benefit the trans women community despite our participation in these studies. Add to this the local political context, the shortage of HIV-related drugs, and the change in regimens for people living with HIV promoted by the Peruvian Ministry of Health. And we had many things, we're worried about many things, especially for social exclusion and lack of specific policies. And although trans women have been part of important medical research, they still face social exclusion and a lack of adequate prevention and protection policies. For modification of the trans community, and research appears to have used the trans community to obtain data and results without a genuine focus on community education, prevention, and empowerment. It is highlighted that trans lives have been commodified, and research has treated participants more as objects of a study than as human beings worthy of support and respect. Sorry, my English is not too fluent. I just absent of community strengthening, trans organizations have not received the necessary strengthening, and there has been no investment in their development, professionalization, or in the creation of real opportunities to growth and self-efficacy.
Thank you.
For finish, the trans women community demands a profound transformation in the way public health, research, and policies in Peru address the trans community. Our demand is clear that authentic community components be integrated and that the empowerment, development, and protection of transgender people be prioritized in addition to greater political responsibility for their rights and needs. Thank you.
Thank you so much, Isabella. And I think these are points noted. These are advocacy actions that we do need to push at the conference. Even if you're not at the conference, I think, and we talked a little bit about this yesterday on what inclusion looks like, especially like for trans people. And Simon, I see your comment in the chat talking about risk as best on the participants in Purpose 2 compared to those in Purpose 1. So thank you very much. I see we are getting to the top of the hour. I want to call Yvette. As I mentioned, the Advocates Corner is still open. It's going to be open till tomorrow. And there's sessions that are going to be happening in the corner. If you're at the conference, feel free to pass by and attend these sessions. But I want to call Yvette to just talk a little bit about intergenerational leadership. And I think this is not something we hear a lot in HIV prevention advocacy, but just to, and I see there's a lot of presence in terms of like young people being engaged in the conference, but also outside of the conference in HIV programming. Just Yvette to just give us, and she will have a session about intergenerational leadership, but just to give us a snippet of what this session will look like.
Thank you so much, Bridget, and good morning, everyone. Congratulations, Ida, for that powerful wrap-up of yesterday, as well as Isabella, to just acknowledge that some of our wins is still other advocate struggles from across the world as well. So first of all, just to apologize, we had a mix-up with our session that was supposed to happen today. We are moving it to tomorrow after the manifesto session, or we will work something out. But I think importantly is that we need to start talking about what this intergenerational leadership looks like beyond the rhetoric, beyond the, just going around and having young people in sessions without really meaningfully engaging them in programs, in leadership roles that are paid for. So it's important that we start having that discussion, and leadership is not only for young women, but how are we engaging men and boys in this leadership role with scenarios without, taking away from what it means for women. So APA will be having our session on intergenerational leadership still at the Advocacy Corner. We will send out blurbs and let people know when that's going to happen. But I think it's an important conversation, because beyond us presenting at conferences, standing in front of rooms, is the reality that young people need to make a living, a living that's worthwhile for them beyond just per diems. So how do we really engage young people to also work in HIV advocacy meaningfully and make decisions and start seeing this as a career and something that they can do? So very, very excited about our session, and I hope you guys can join us. And that's what the Choice Manifesto also is all about. So yeah, thank you so much, Bridget, for the opportunity.
Thank you so much, Yvette. And I think, that would wrap up really today's daily debrief. I look forward to seeing you all tomorrow. We are going to be wrapping up the conference. We really are going to be having really just highlighting those key actions that we're going to take home from HIVR4P as a conference, from the different sessions, from our colleagues that are there in person, but also us who've been able to follow virtually in a way or two. But just to encourage you, for those that are at the conference, please do go to the corner, interact. It's really a space for advocates to be able to network and interact and have conversations. The corner is open for, any pop-up convos, that we call them that. It's really open for you all. Otherwise, thank you so much for joining our daily debrief today, and we will see you tomorrow. have a lovely day. And for the people at the conference, good day to you all. We wish you all the best there.
Thank you,
Thank you.
Bridget.
Thank you,
Bye.
Bridget. Thank you, everyone. Bye.